Hi everyone, today we're going to be talking about the role of donepezil in Alzheimer's. In 2017, Alzheimer's disease was one of the major leading causes of mortality in Australia, resulting in 13,729 deaths, and is recognised as the biggest concern for global public health. Alzheimer's is characterized by the degeneration of brain cells due to the buildup of beta amyloid plaques and tangled tau proteins. This results in a gradual decline of memory and various cognitive and functional skills, which has a significant effect on an individual's daily functions. Unfortunately, there is no known cure that has been established to stop the progression of Alzheimer's disease. However, cholinesterase inhibitors are known to be effective in slowing the decline in memory and thinking abilities. Donepezil, also scientifically known as donepezil hydrochloronohydrate, is a popular drug taken orally and is used to treat mild, moderate, and severe cases of Alzheimer's disease. Donepezil is an acetylcholinesterase reversible inhibitor. Its function is to inhibit the breakdown of acetylcholine. This increases the availability of acetylcholine at synapses, which therefore enhances cholinergic transmission. Acetylcholine is responsible for memory formation, muscle movement, and learning. By preventing the breakdown of this chemical, it will help minimize Alzheimer's symptoms. Patients taking donepezil are at risk of developing side effects such as nausea, vomiting, diarrhea, and in severe cases, chest pain, heart problems, and seizures. Age plays a significant role in the occurrence of adverse effects, as it's been proven that patients over the age of 85 have double the risks of developing side effects. To complicate things further, interactions can occur between donepezil and some common medications, including antihistamines and antidepressants. An article published by Springer International Publishing Company assessed the efficacy and safety of donepezil in patients with mild to moderate Alzheimer's disease. The study consisted of an open-label, multi-center trial with a total of 1,113 patients from 18 countries worldwide, although 59 patients discontinued the trial due to adverse events. Patients received 5 mg of donepezil each day for 28 days, after which the dosage increased 10 mg for the remainder of the trial. Cognition was assessed by a trained clinician using the mini mental state examination at baseline week 4 and week 12. Changes in patient activity and social interaction were evaluated using a caregiver diary and a 5-point scale. The results of the trial were significant, as a t-test of 0.5 was achieved. Patients also experienced significant improvements in cognition, patient social interactions, engagement, and interest. A study conducted by Nan Zhang and Mark Gordon highlighted the clinical efficacy and safety of donepezil in the treatment of Alzheimer's disease in Chinese patients. A 12-week randomized controlled trial was performed with 808 patients, where one half was treated with 5 mg of donepezil and the other half was given a placebo. According to the results, patients with mild to moderate Alzheimer's that were administered 5 mg of donepezil performed better in assessments of mini mental state examination, the clinical dementia rating, and the activities of daily living tests compared to the placebo group. It has also been highlighted that patients with donepezil in their system showed significant improvements in psychological mood symptoms and cognitive function, especially memory and visual interactions, by 59.8%. Acetylcholinesterase inhibitors such as tacrine and physostigmine are common existing drugs used to treat Alzheimer's disease. However, due to their short half-lives and toxic effects, they are seen as unideal in treating Alzheimer's disease. Donepezil treatment is continually improving the quality of life in many Alzheimer's patients. In fact, it's been reported that 40 to 70% of Alzheimer's patients have experienced positive effects of the drug. Many studies have proved that donepezil improves a patient's ability to perform daily activities, allowing them to be more independent and less reliant on caregivers. Donepezil is also proven to extend the life expectancy of individuals, resulting in a decreased mortality rate. Although the cost of the drug is roughly $327 per year, which can be a financial burden to the elderly and retired patients. Overall, donepezil is a reliant drug in the management of symptoms in Alzheimer's patients. Thank you for listening. We hope that you learned something about donepezil and how it helps Alzheimer's patients.